Well, hi, everyone. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. We are back today with another MGMA Insights Podcast, and I met our guest through a mutual friend who's a MGMA member in a medical practice, and so I got to talk to this guy. So our guest today is Mark Noon. He is a retired U.S. Air Force medical leader and founder of LEADERSHIPTEN. Mark's also an executive coach. He's a speaker who's worked with hundreds of healthcare organizations. Some of you listening today may have worked with Mark at some point in your medical practice. So let's just welcome him into the show. Mark, it's good to talk to you again.
Hey, Daniel, thanks so much. I appreciate the opportunity and love being, I say back in the medical community. I don't thrive there with my new business, but I certainly have spent a lot of hours on site with a lot of medical practices. They're MGMA members. So glad to be a part of the show.
Yeah, it's so good to have you here. You and I talked, I think it was a week or so ago. Time just kind of
goes by.
It just sort of floats these days. I'm trying to keep things. You said you were traveling today. I was telling you, I thought I'd had maybe 7 meetings total today. Yeah. Y'all have probably y'all listening have had days like that where we're just going, I don't know what time of day I don't know what day it is.
Yeah,
so
I don't know what day exactly. I know. I've had days recently like that. I have no idea what day it is. So.
Exactly. So let's just start with your story. It's so interesting. Anytime I talk to somebody who has maybe a military background or has a background that might be different than, I want to say traditional, but these days there's no traditional pathway. I guess the most traditional, if we think about it, might be, I want to be a doctor. And you say that when you're in 5th grade, and then you just go to college, then you go to med school, and then you're a doctor. But other than that, there's usually so many permutations or so many different ways to get to where we get in our careers. So let's just hear a little bit about your background.
Yeah, and I love to hear people's stories too. Why did you become a nurse? Why did you become a, anesthesiologist? And there's always something back in the background. It's not usually you just woke up one day and went, I'm going to go into this. There's usually something that happens, right? And for me, it was joined in the military many, many years ago, more than 30 years ago now. I just needed a job. I wasn't looking for a medical profession. I wasn't looking for anything other than I needed a job. I had a wife, a young son, and we lived in an area of the country that not a lot of jobs. I had no education. So I said, let's join the military. They gave me the job in the medical laboratory world. Didn't know anything about a lab tech, didn't know what lab techs did. So it wasn't like one of those dream jobs for me. That's the one they gave me. And most people who know me know that my personality is not the typical lab person who loves to be quiet in the back room kind of thing. I'm very much a people person. But that's the job I got in. And in that job, went through the ranks, got an opportunity to finish my 4-year college degree, which took 8 years to do. Got a commission as an officer, began the second part of my career in the same career field, clinical laboratory. My degree is medical technology, and then was able to finish a master's degree as well. And then, finish out just a little over 20 years in the Air Force. And so that's where my medical experience comes from. In that time, especially as an officer, a lot of executive experience, a lot of time at the executive table, a lot of time in leadership roles, not just clinical roles, but leadership roles within the medical community. And even then, doing a lot of speaking and a lot of talking about leadership.
Yeah, that is so good.
That's the military part of that. That got up about 2012. So
okay. So bring us up to speed then. I mentioned it in your intro, LEADERSHIPTEN. Tell us about this organization, what it does, and anything else you might want to share about it.
Yeah. So between 2012 and 2020, I worked for a company called the Studer Group. Many of your listeners are familiar with Quint Studer, one of the probably the premier, leadership and clinical guys, out there in the United States. And then, of course, that became Huron Consulting Group, at some point in time in that 8 years as well. And I worked for them. I traveled all over the country into Canada. I spoke at probably more than 250 healthcare organizations during that time. I did a lot of coaching, a lot of leader development, because one of the main focuses was not just the clinical elements of HCAPs and CGCAPs and all those other things. It was really about how do we develop the leaders? Because we know the leaders leading well is going to have great employees. Great employees are going to bring great healthcare. And then in 2020, 2020 happened and there was no traveling. There was nothing really much going on. And so it was a big time when it was just time to transition. And I made the transition. A partner and I developed LEADERSHIPTEN. LEADERSHIPTEN is simply an organization of the three of us, three founding principals, who wanted to develop leaders. And we really started it as sort of a side hobby. And it just sort of blossomed from there. We're not specifically in healthcare. We do all industries. I have industries in government. I have, private sector businesses, large scale industries, industrial places, real estate agencies. I mean, all kinds of different elements, but still love to be in the healthcare practice. You're and my mutual friend Oscar is the one that sort of partnered us together. I'm coaching their practice right now as a medical practice from a leadership and patient experience perspective. So that's kind of how LEADERSHIPTEN came about, sort of a side hobby that developed into this business. And now it's sort of my full-time travel around the country and the world talking about leadership.
Yeah. So one last question. What's the 10 represent? So I know what leadership is. What's 10?
Yeah. It's interesting that we came up with this name one day. In fact, sometimes the three of us, my two partners, Diane and Rob, we think about where did it really come from? And I think we were just at lunch one day and one of them said it. I didn't come up with it. One of them did. When we found out leadership, 10 is really this. 10 is sort of the perfect, right? We think of everything on a scale of 1 to 10. If we get a 10, even on HCAPS, CGCAPS, all those, it's perfect. We've done everything right. 10 is also, it's complete in our opinion. One of our core values is integrity. And integrity for us is not just about honesty. It's about fullness and completeness. And then interestingly, when we started coaching, we ended up with 10 sessions of coaching. We do 4 leader development times with the organization and 6 coaching sessions. And that added up to 10 coincidentally. And then the word leadership has 10 letters in it, which was something we discovered after we developed the name. Never even thought about it, right? So that's really kind of how it came about. There's no real meaning behind it other than that.
Yeah, I love the synchronicity of life. You're trying to brainstorm for something. You come up with this name, then you just realize, well, there are also 10 letters there. So we didn't go with Leadership 3. So, because there were 3 of y'all, but you went with LEADERSHIPTEN. Some of your trainings are in groups of 10. So that really is synchronous there. That's really cool.
Well, what's interesting too is we sort of are nicknamed L10 just for shortening the term. But a lot of our organizations that we coach will develop their own. Like we had one organization just recently, there's 6 executive leaders on their team, and they decided to call themselves the L6. So it's the Leadership 6 because there's 6 of them, right? So it's sort of morphed itself into some of our clients as well.
Okay. Let's talk about medical practices and the leadership found there. You have talked, as you said, our mutual friend Oscar, he is leading a practice. You're working with them. You've worked with hundreds, maybe even thousands of healthcare professionals that you've talked to over the years. Right. What are some recurring themes that are challenges that medical practices have as far as from a leadership perspective?
Yeah, it was different before 2020, like everything, a lot of things in life were. The way we delivered medicine, different. The way we deliver anything now is different. The way our packages are delivered, or the way we conduct meetings are different. But, I think there's a common theme in all leadership, and it's not just medical practices, but there's some nuances to medical practice. And I'll talk about those in a second. It's really the challenges for leaders are typically 4 things I find in every organization. It's communication. Imagine that, right? Everybody has communication, number 1. Motivation, delegation, and culture. So it's communication. Yeah, everybody knows that one. Motivation is learning how to motivate your team. And a lot of that is shifted with different generations now. We've got 4 or 5 generations in our organization. The difference between a boomer and a Gen Z is there's many differences, but their motivations are different. Delegation, it's the ability to give up things. In healthcare, we really struggle with delegation because we have this need to nurture and take care of people, right? Person becomes a nurse because they want to take care of people. So then they become a nurse leader. And I will just tell your audience this point blank. I think there's not a harder job in the world than being a nurse manager in a hospital. But a nurse leader who now is responsible for all these people and all these patients, and they want to take care of everybody. And so they don't delegate. They go, I'll take care of that because I don't want to burden my staff. And so delegation is really a hard one for a lot of them. And then culture is that last one. And culture is Not a lot of people can do a lot about the culture of their organization, but they sure can within their department. And even though they may have not great leaders in the upper levels of their area, they can do something about the culture and creating that culture. But they struggle with that. They struggle with it because they feel like it's not always their responsibility. If you're my boss, it should be your responsibility to help me develop culture. Well, what if you're not a great leader? I need to still take good care of my people. And that seems to be a struggle for a lot of them.
Yeah. You were bringing in the context of 2020. That is a really monumental year globally because of the pandemic. We saw in a lot of organizations, people, we had the lockdown and people work from home. Certainly clinicians, they needed to see those patients, but a lot of the administrative people in healthcare, they might have seen their work life, the way they work, change.
Yeah. Right.
In the context of culture, how has culture changed? You've been consulting with and working with practices and other organizations, so you're seeing it in other walks of life as well. How has culture changed over these past 5 years?
I think a lot of organizations, especially large healthcare organizations, really struggle with culture because there's so many entities within the system, if you will. I mean, I've spoken at some of the largest healthcare organizations in the country, and some of them 80, 90,000 employees. How do you develop a culture in that? It's really hard. Every individual building or department has their own culture. Now it became even more difficult when a lot of those people went to their own homes and are working, and some of them still working from home. And so it's that, how do I incorporate them into a culture? How to create a culture when you're sitting in your office there on the other side of this screen and I'm sitting in this office, and that culture is very difficult, even more so now to manage than it was then. But there's ways to do that. And that's what I think I want to encourage leaders is there are ways to do that. There are things that they can do. It may take a little bit more work because you're not face to face in the sense of, live and in person, you're by a screen. You don't know what's going on all day long. I'm here. I told you I'm visiting my daughter. I'm here at her house. She works from home. She'll work for 2 or 3 hours and then go take care of her son for 2 or 3 hours.
Right.
And go back to work for 2 or 3 hours or whatever, it's flexible. So you want to meet with at 3:00, that may not always be a convenient time to have a meeting because some people are working I love to get up early in the morning, 5:00 in the morning, be at work, get everything done before the day starts, right? Who else wants to have a meeting at 5:00 in the morning? Nobody. So I'm having meetings at 2:00 when I'm wanting to take my afternoon nap or whatever.
Right. Right.
Those are some struggles, but they can be accommodated. They can be worked. Leaders just need to, adapt, if you will. I think the needs for people are the same. It's the adaptation of how we deliver that is a bit different now.
Right. I was thinking about that. I am also an early bird. I use that 5 a.m. time to have the me time, whatever it might be. I belong to a gym, and once that day gets going for a lot of us, I can't really turn it off. And so if I wait to go to the gym at 5, I might find an excuse not to go. So I go there. So I get all that out of the way. So then I can focus in. What I love, what you were saying, is that flexibility. I think that's one of the pros that has come out of that. Any of us who's had Zoom meetings or other video type meetings, we see our furry friends show up. I had one of my cat jump into the screen 2 days ago when we were having a pretty important, business partner meeting, but everybody, they're so used to it. They said, well, I'm going to go get my dog and bring it, so we have that sort of flexibility there, the flexibility to maybe go to that class or go see our child perform or, in a performance or compete in an athletic endeavor and then get back to work. But the thing that comes up there is it is the trust factor. If you're the boss, can I trust you? Can I give you this much rope? You're to get the flexibility to do some different things during your day, but then are you going to be present when you need to be present? So is that something that you build in some of the training so that trust is there? But it's a two-way street, for us.
It is. There's a lot of statistics that even show that work from home is more productive. Like I said, if I get up early in the morning and I hit my computer, I go to the gym like you do, and I get home and I hit the computer, I'm doing all my work. I get more done in an hour and a half than I would for 3 hours at the office because of interruptions or just the time of day, whatever, those kind of things. So I think that flexibility is absolutely important. I had to laugh when you were saying, the cat jumped in. I was on a Zoom call one time I was going to speak at an event, and we did like a pre-call where we're talking about the event. And the young lady who was on the call, she had to breastfeed her child, and she was doing that while we were having, it's all covered up, of course, but she's doing that while we're having the meeting. And I'm like, it's just the way we've adapted. And some leaders can't do that. They have a hard time making that adaptation. And again, I'm not saying that's maybe a little extreme that we don't do that, but I don't have to go get the dog to show you. But my dog's going to bark on the other side of the door sometimes if the UPS guy hits the front door and I'm in a meeting, right?
Right.
We've adapted. Okay, how are we doing that with our team? Are we allowing some of that flexibility? I think that's a big key.
Yeah. In reading about your company, LEADERSHIPTEN, your company's tagline is, I want to get this right, we challenge the thinking that shapes leaders. What do you guys mean by that?
Yeah. There are absolute principles, I think, when it comes to leadership. I think there's tried and true studies. You read all the greats of time, John Maxwell, Patrick Lencioni, different ones of those, our time frame that have, there are things that are absolute. But at the same time, I want to challenge people to do things differently. That's where I go to that adaptation. I coach an organization up in upstate New York, travel there every month, and it's a group of guys who have never had any real leader development before and have, led teams on these are underground construction guys. They have led teams, they've led people, but they've never been challenged in their leadership. And what they think about leadership is what they were taught growing up in the business. You yell at somebody to get them to do what you want them to do. Okay, maybe that worked 20 years ago. It doesn't work today. So I'm going to challenge that thinking and say, okay, what can you do differently? Challenging the thinking is, what are you experimenting in leadership right now? What are you doing and trying as a leader that you think might work? What are you willing to put out there and be vulnerable and say, I'm going to try this, see if it works with my team. And if it doesn't, I'm going to go back and say, hey guys, I tried this. It didn't work. Let's go a different route. Let's make it happen, right? That's challenging the thinking. It's getting them to actually think, critical thinking. We use a line like this. If somebody would come to me and say, I say you worked for me, Daniel, and you and James worked for me, and somebody came to me and said, Mark, do you guys, are you a good leader? And I'd say, well, I think I am. Okay. And then they'd say, well, would Daniel or James say you're a good leader? And I'd say, well, I think they think I'm a good leader. Right. And then we go one step further. We go, well, I think that they think that I think I'm doing a pretty good job. Right. So I want to challenge that thinking. I want people to go, okay, maybe my thinking isn't where it needs to be. How do I? And then the other side of that is critical thinking. I want people to be good critical thinkers, not just, okay, I got to put this here because that's the way we've always done it. But does that really make sense, or can we do it a different way?
That leads right into my next question. You have coached and offered trainings to everybody from physician leaders to office managers, everyone in between. Does the training change? Do you have it, depending on what a person's role is in an organization, do they go through a different type of leadership training? Or talk about that, how you tailor that.
Yeah, it's going to be dependent on the practice, dependent on the patient population. Obviously, if you have a pediatric clinic, is it going to be a little different how you handle patients than it is with a geriatric clinic? Yeah, absolutely, right? So there's some differences because patients are different. There's differences because employees are different. There's differences because roles are different. What I love to do, especially in medical practices, I've done this for many, many years, is do a lot of role play things where, okay, let's say we'll pick you and James and I again. So James is the provider, nurse practitioner, physician, whoever he might be. You're the nurse in the clinic. I'm the front desk person. Okay, does James as the provider have any idea what I do at the front desk? Maybe not, right? He doesn't know what I'm telling patients. He doesn't know how I'm processing patients. He just knows when the patient gets back to the room, they might be ticked off or a little annoyed by something. He has no idea why or what happened. You might not even know what I do at the front desk, but you come out and get the patient who I maybe upset in some way or wasn't really communicating really well to, and then you have to try to explain things. And then, or you don't do a good job explaining, and then they get back there and James has to take all this time to explain it. So I love to take people through the whole scenario Patient walks in. How does Mark interact with him? What does he say? What does he do? What kind of things does he lead up to? So when Daniel comes out to bring them back to the room to triage them or do whatever, that communication is already there. And they feel like you are kind of already know what their concern is or what they're there for without having to ask the same questions over. And then when James walks in, the patient's almost excited to see James as the provider because they've heard so much about him, or they've heard what this person's done, this provider's done for other patients. It's that kind of thing. I call it concern, coordination, and confidence. There's 3 elements, and I walk through the entire clinic. Everybody watches what Mark does at the front desk and critiques it. Everybody watches what Daniel does in the triage part and critiques it. Everybody watches what James does as the provider and critiques it. Then you come together at the end and say, what did we learn? Mm-hmm. And James is like, well, I learned that Mark says this, and I don't want my patients to know that or to think that, right? Or we find out James is telling something in the back, and I've told something opposite in the front. I got to get those things coordinated, right? That's what I love doing in clinics. Yeah. Lunchtime, workshop, 1 hour, 2 hours, and we just walk through these scenarios, and people go, oh my gosh, they had no idea these kind of things went on in other parts, especially if it's a pretty large clinic, right?
Mm-hmm. For
so
sure.
That's the fun part. I love going in places and doing those kind of things, right?
Yeah. Yeah. And just for our listeners, James is the superpower we have here. James is our producer that puts this thing together and makes people like Mark and me look good on camera and sound good on camera. And so if you're going, who the heck is James? So
we just made his name up. No, but he's actually part of, he was in the background. I should have probably said that.
No, I just wanted to, James has long been the secret sauce here. And I think people needed to know who he was. So thanks for bringing him into it, Mark.
Yeah, good.
We were talking about trust earlier, and this is sort of a play off of that. Let's talk about accountability. So when you're talking to a high-performing medical team, what does accountability look like, and what can they learn about that or grow that accountability factor within their practice?
Yeah, accountability is it's a two-way street. We a lot of people look at accountability as, okay, you're Daniel, you're the leader of the practice, you're the COO or the CEO or the whatever role you have, the top person. They think your responsibility is holding everybody accountable, and it is, it absolutely is. But what do I have in responsibility and accountability? I have 3 or 4 people that are under me that I supervise. I have to hold them accountable, absolutely. But I also have to hold myself accountable. My team has to hold me accountable. I don't think we do a lot of upward accountability. You say to me, hey, Mark, I'm going to do this and this for your team. And I tell my team that, and then you don't do it. What am I supposed to do? I need to go to you and say, hey, you said you were going to do this. You didn't do it. Now, it should be upon you to take accountability and the responsibility to do that. But I tell leaders all the time, if your boss, your supervisor does not take accountability or does not take accountability for themselves, you need to hold them accountable. Well, in a lot of organizations, that's hard to do. They don't have the culture that allows that to happen. I remember one of my first months when I worked for the Studer Group. I remember one of my colleagues who I was supposed to have some information to her on a Friday. She was going to have a Monday call with my hospital CEO that I was coaching. And she was not my supervisor. She was just a peer, but she was going to help me with some things. I was early in the career and needed some help. And I didn't get the material to her on Friday. And she emails me on Sunday. She says, hey, Mark, you didn't send me that stuff. Our core, one of our core values in the organization is commitment to our coworker. When we say we're going to do something, we do it. And you didn't. She called me on it. Now, I could have blamed the system. I could have said, oh, unless I sent it on an email, unless it got lost in the system, right? Or whatever. You know what? I owned it. I said, you know what? That will never happen again. And it didn't. But it was the first, even though I'd been in the military 20 years, accountability was not that strong. And it was one of those lessons I took personal accountability. I was wrong. I admitted it. Never happened again. And it's been, 13 years since that point. And I still remember that as a very strong lesson, right?
Sure. Yeah. And when you think about accountability, you describing it in that way, it reminded me of one of our guests and authors that we've worked with at MGMA, and that's Owen Dahl. And he has a saying, he teaches a course at MGMA on lean leadership and has just written a book for us on lean leadership. Yeah. And he has a saying that if you can't measure it, you can't manage it. And so I think if you have a repetitive project or a process, say it's a monthly report that goes out, but if you were measuring that and it somehow went off the rails every month, you could maybe go back there and measure that and see where the bottleneck was. It might be Jim over there. He has that one aspect of it, and you go, okay, so let's go back and coach Jim. So giving you that scenario, what do you think about that? Is that something that you teach in some of those leadership programs?
Yeah, there has to be a sort of a checks and balances, right? There has to be something to measure again. There has to be a standard to hold people accountable to.
Mm-hmm.
It can't be different throughout the organization. If you have a standard for your team that's 3 points above my standard, and I'm holding people to the standard, let's say it's organizational standard, but you've changed the standard, either raised it or lowered it, those people are going to talk to my people and they're going to say, well, why are we held to this accountable standard and this one isn't? So it's got to be measured. Yes. Healthcare, we say all the time, if it's not measured, if it's not documented, it's not done. If it's not measured, you can't manage it.
Yeah.
But there has to be a coordination of that information. There has to be a standard that's set that says, this is where we're going to be. Now, if I go to my team and I say, I know the standard is this, and everybody is at this standard, but I want to raise it 2 levels above, and my team says, yes, we want to do that, move forward. Absolutely. Mm-hmm. Then there's no comparison in that way, right? But if it's because I'm not holding my team accountable and you are, they're gonna talk, and there's gonna be some grumbling and complaining. And when that lack of standard is there, it will ruin an organization. It will ruin a culture.
Okay. Now, healthcare can be very localized because you have your bricks and mortar space that patients come into. But in reading about you, I did see something that was really interesting that I just wanted to explore in front of the MGMA audience, just so we could get an idea of things. And that is that you've worked with organizations across 5 countries. So when we talk about culture, leadership, resilience, any of these things, have you identified any similarities or any differences when you're working in the U.S. and these other countries that you've worked in?
Yeah, I've been in a few other countries, and in some of those groups that I've spoken to have been multiple countries represented. A lot of times it was a conference of multiple countries. And a couple of those have been healthcare, and a couple of those have been other industries. People are people. I used to get this asked in the military all the time. What do military people like compared to others? I said, people are people. We have the same motivations, the same desires. The differences in the military is I could hold people accountable to things because we had absolute set standards and we had processes for that. In other countries, it's very different. I was in Thailand earlier this year and doing a conference on leadership, and it was probably one of the most difficult audiences because of the differences in Far East. There was Far East, a lot of people from the Far East, India and other places. Just a different mindset on how leadership is. I also think that part of it is, as an American, I talk very fast. I think a lot of other countries don't talk. I think that's part of my communication is I need to slow down. Where I was in Dubai a couple of years ago, multiple countries there, all public health officials. For whatever reason, I slowed down everything that I said because a majority of them, English was like a third language, not just second or third. And so there was a lot of, I tailored the information differently, or how I presented the information differently because of that audience. So there's things like that I think that leaders have to be able to do and understanding even today. Even in the United States, we have people from multiple different countries and languages and culture and backgrounds, and they don't all see things the same. I was coaching an organization in Florida, in the Panhandle of Florida, where I live. And there's a young lady there who was originally from the Philippines. So English was her second language. Of course, Filipino people are very Americanized in just because of how many Americans have been there and them being so closely associated with us for years. But she's also a very hard personality from a behavioral standpoint. She's a high D on the DISC scale, which means she's very direct and she's very forward. And in her country, that worked. And what she realized is that with the people that she supervised in Florida, she had to sort of tone down the way she delivered her message. And should we get colleagues of hers, to read her email messages so that they didn't sound so direct and so sort of overbearing? She knew enough about herself to do that. And I think that's the cultural differences that we have to look at sometimes.
That is so fascinating. So I could talk to you all day. I mean, you and I have already chatted a couple of times now, and we just have a really good rapport. But for the sake of time here, I want to be respectful to you. So as a final question then, what would you want to leave these MGMA members? These are practice administrators. These are physician leaders. These are people on the front line that are working with patients, either through the billing side or the clinical side. What would you want to leave them with about leadership and how they can grow their leadership skills?
Yeah, let me give you three things, and this is standard for everybody. In fact, you will find that this is exactly what every employee in every medical practice around the country wants from their leader. They want to know who their leader is. They may want to know them personally. They want to know them, what their values are, what's important to them, who they are as a person, their behavioral style, all those things. They want to know them. Secondly, they want to know that they're good at what they do. And I don't mean being a good physician, being a good nurse, being a good, billing clerk. I mean, are they good leader? Are they a good leader, or are they trying to become a better leader? Are they working at becoming a better leader if they're new to the role or they haven't had, a lot of experience in the past? And thirdly is, do they care? Do they care about the people that they work with? And not a lot of times in medical practices, we get hung up on the processes that we have to try to get patients through and try to get the billing done and insurance and all those kind of things, but we forget about caring about the people. Now, think about this from a patient perspective. What are the three things every patient wants from their provider? They want to know who you are. They want to know you're good at what you do. And they want to know you care about them, right? Same exact thing. So if we can nail those three things, we got our employees taken care of. We got our customers taken care of. We got our patients taken care of. We got everybody that we come in contact with will be well cared for in the medical practice if we can get those three things across.
All right. Well, Mark Noon, thank you for joining us on the MGMA podcast today.
It is a pleasure. Thank you so much.
Yeah, that was so much fun. So everybody listening, I'm going to put information in our episode show notes. And if y'all are loyal listeners to the podcast, you know that we always create articles as well. So we'll have a lot of information about Mark and his leadership skills and tools in our articles and the episode show notes. But if you want to go out and learn more about Mark right now, go to leadershipten.org. And you'll find a lot of tools and tips out there as well. So until then, thank you all for being MGMA podcast listeners.